So the question we're thinking about in this video is, what's the point of critical appraisal at all? Why bother? So thinking about it, you have a poorly patient, you give them some medicine and they get better. Yay! It must have been the medicine, yes? Yes? Well, maybe, but is it clear and obvious? Not always. Some things are. So thinking of another example, let's take two people and try something on them, say parachutes. Now clearly, parachutes are a good thing. We don't need a randomised controlled trial to see that. If you're jumping out of a plane, take a parachute with you. But lesson 1 is that medicines are not parachutes. It's not clear and obvious they work. But why not? Well, take our patient again. We give them a medicine and they get better. The medicine's clearly worked, yes? Well, no. Something has, but it's the whole treatment, not the medicine. What do we mean by this? So, the treatment has an effect, say fixing a headache. But what's this made up of? So part of it will be the patient just getting better on their own. Even if you only give them sympathy, some people will get better. Give them a tablet, any tablet plus sympathy, and some more people will improve. Tell them it's a really expensive tablet and put it in a shiny box, and even more will benefit. So finally, we give them all this plus a drug that actually works, and all this adds up to the treatment effect. So what does this mean? It means some people will get better from anything, even if you do nothing. Also, the placebo effect helps more people feel better, and the bit the drug does is easy to lose in the background noise. So this big chunk is the noise, and this little bit is the drug effect. It's separating these out that's the point of critical appraisal and evidence-based medicine. But why is this important? If people are getting better, isn't that the important bit? Well, if looking at one patient, maybe, but we aren't. We're looking at a population, and if we're paying for an expensive medicine when Smarties and sympathy will be just as effective, then we're wasting resources that could be used elsewhere on things that actually make a difference. So for an individual patient, we could maybe live with non-evidence-based practice, but for a population, it's important to follow the evidence, particularly if you're spending money on things that don't add value. Plus, pharmacy is a science, and science is important.